instructions and commands that they need to undertake. So if that's the case, we've recommended the patient to apply some medical grade olive oil spray prior to entering the water. So it just adds another layer of oil to help protect the skin, repel water. So if it does enter, hopefully it will repel back out. Also advise them to use an acetic acid spray. The acetic acid will help replace any natural acidity that's lost. So as these oils that I described earlier are washed out of the ear, once they're leached out of the ear, to replace the acidity, so to help prevent the onset of a secondary ear infection, swimmer's ear, otitis externa. We want to replace the acidity in the ear, so an acetic acid spray can help, which is essentially kind of a vinegar. And sometimes you can use, if there is excessive water in the ear, a 1 part alcohol, 1 part white vinegar solution. So it's almost similar to the acetic acid spray. But you're also adding some rubbing alcohol. And I think the solution is 1 part of each. And what alcohol does, it binds with water molecules, and alcohol has got a much lower evaporation temperature point. So if you've got pure water in your ear, it will take a long time for the water to naturally evaporate, and in that time it can macerate the skin more, it can leach away more of the oils, it can just do more. The longer the water is in the ear, the more damage it's going to do. So alcohol, it combines with the water, and it homogenizes with the water, and it can then evaporate far quicker than water alone. So it dries out the ear quickly. If you get rubber alcohol on your hands, during COVID, we've all been obviously doing that a lot. A lot of people get irritation because it dries the skin. But of course, if you've got excessive water in your ear, that's what you want to do. Another solution is to use, there's a drops that we actually sell on our website. You'll see there, www.clearwax.co.uk. There's a drops that we sell, it's just to the UK, mind you, so just bear that in mind. It's called Clear Relief Drops, and that contains 2 main ingredients. It contains glycerol, and it also contains lidocaine. Now, glycerol works very similarly to the alcohol. It combines with water molecules to form an homogeneous solution. But glycerol also is quite an oily substance as well. So it absorbs the water, but it also helps to moisturize the skin afterwards because it's got this oily texture about it, a greasy property characteristic. So glycerol, it won't evaporate as quickly as the alcohol because the evaporation point's higher, but it absorbs the fluid, the water, excessive water out of the skin cells. So it helps to prevent the skin from macerating and an infection occurring. And the lidocaine is a topical anesthetic, so a lot of dentists use lidocaine when they're performing their dental care. So if there is any pain, because of course if you've got swelling and inflammation in the ear, it can be painful, and the lidocaine just helps to numb the